So the first step is to preload the PCR tube. When opening the tube, be careful not to touch the inside of the lid. You can use a tube opener if that is preferred. Now we're going to preload 1 microliter of wash buffer to the bottom of the Juno PCR tube. So again, preload 1 microliter of wash buffer to the bottom of the tube, and be sure to avoid bubbles. Now we are going to make 3 50 microliter drops of wash buffer. So again, 3 drops of 50 microliters of wash buffer. We're going to make the droplets flat by tapping gently on the counter. The next step is to set the stripper tip to 1 microliter, and we're using 100 micrometer stripper tips. We're going to preload or prime 1 microliter of wash buffer into the stripper tip. So preloading 1 microliter of wash buffer into the stripper tip. We are going to go to the biopsy drop, dispense the wash buffer, and aspirate the biopsy sample. Should now have the biopsy sample loaded into the stripper tip, and you can see that there's a lot of oil that's remaining on the stripper tip. We're going to want to wash that oil off in the first wash buffer droplet. So keeping the stripper tip at an approximately 30-degree angle so the entire surface that touched the oil is washed, we're going to go from the top to the bottom of the droplet, kind of wiping across the droplet to clean. You can move across the same droplet. And now you can see that the oil has been removed and the oil is now remaining in the droplet. Remember that oil will affect the ability to obtain a PGT-seq result, so washing is really important. Now the biopsy sample is in the stripper tip, and we're going to move to the second drop of wash buffer. So moving to the second drop, we're going to dispense the biopsy sample and discard remainder of the media outside the wash drop. Since there might be oil remaining on the stripper tip, enter the second drop from a different angle. So entering at a different angle, we're going to pipette in and out about 5 times, moving the sample around so it's in a clean area. Once you've done it about 5 times, you want to aspirate the biopsy sample and move it to the third drop. Discard the extra wash buffer outside the wash bubble. And again, enter at a different angle and pipette in and out 5 times, moving the sample around so it's in a clean area. Again, pipetting in and out 5 times. now we're going to load the biopsy sample into the Juno PCR tube that was preloaded with 1 microliter of buffer. Throughout the process, you want to make sure to avoid touching the inner side of the tube. Once you dispense the biopsy sample, you should be able to visualize the biopsy sample, and the total volume should be less than 2 microliters.